We now welcome Gillian Carleton-Boylan, Assistant Professor in Public Health. Gillian is here today to talk us through about the range of public health master's courses that the university offers and how to choose the right degree for you. Welcome, Gillian. So, to get started with our first question, we know that University of Nottingham offers 3 public health master's courses. So it's public health, global health, and public health, health research. So could you talk us through the main differences between them and what kind of student might be best suited for each?
Well, public health is for anyone who's interested in the health at a population level. So with all our master's courses, students will gain the theoretical knowledge and the practical skills to be successful within the field of public health. With our global health course, we focus on, as you can imagine, a global health perspective, and students learn about issues and problems which are pertinent globally and how those can be addressed at a global level. And with our research program, so our health research, we focus on research methodologies, so students will gain an understanding of research skills in both qualitative and quantitative research methods.
Perfect. And as you already just mentioned, research plays a big role at University of Nottingham, and the public health research does influence teaching on these MSc courses. So do students get the chance to be involved in research themselves then?
Yes, they get a chance to be involved in research. So as part of all of the degrees, students do a project module, which is where they get to do their own research and they get to choose on their own topic and the methodology that they would like or to use, and they get or to develop that interest further. We also really believe on the Masters of Public Health courses in the importance of research-led teaching. So a lot of our academics are researchers of national and international standing, and they take that expertise not only in the methodologies but also within other topics, and they bring those into our teaching. So in terms of our teaching materials and activities that students do.
Great. So do students have opportunities to work with public health organizations, either through placements or project work?
So while there are no formal placements or project work with organisations within the Masters of Public Health programmes, students do have the opportunity within the project module to work with other public health based organisations if they arrange that. So in the past we've had students work with local government, we've had students work with other public health organisations, and some of our students have worked with one of our larger sports teams within the city of Nottingham to gather data from match days. So it's very exciting, and there are opportunities, but there's no formal placement as part of the master's programs.
That's great. Now thinking about career progressions, so what kind of career paths do graduates from these courses typically follow? So are there any certain specialisms? Do you think they are open to these specific courses?
Well, public health is so varied that our students can work in a multitude of areas. So in the past, we've had students work for health services. So in the UK, the NHS, but also global health services. A lot of our students have worked within local and national and regional government. So local authorities go in the UK, regional health authorities in other countries. Our students have also went on to work in journalism, science, communication, and have worked for NGOs such as the World Wildlife Organization and the World Health Organization, as well as many working in academia. So a lot of our students go on to work within research or as teaching within the universities, both in the UK and globally. And actually, quite a few of our lecturers on the Masters of Public Health programme have also been students of the programme. And I believe we have 7 students over the past couple of years who've went on to do some work with us after they've graduated.
That's really interesting. And since we know that public health is an evolving field, so how do we make sure that the teaching at Nottingham keeps into consideration those emerging trends? If you can comment on that.
Well, I think being very much research-led and evidence-based means that we are keeping up to date with what is happening both within the UK and globally, and that our students really benefit from that knowledge what we have. But we also have very good working relationships with our public health teams within Nottingham and further afield, as well as larger public health organisations.
Great. And thinking about collaboration with organizations, I think I noticed something recently on LinkedIn about the work with John Lewis. So could you comment on that, please?
Well, yes, as part of our innovative and creative curriculum, one of our modules offered the students to work with John Lewis, one of the UK's leading retailers, and students went into John Lewis in Nottingham, and their coursework was to devise a health promotion activity. So very, very exciting, something we're very proud of.
That's really exciting. So I think you have covered a lot of points here. Is there anything else that you would like to add before we end this session?
I suppose it would be that public health and our courses here at Nottingham are for anyone who has an interest in making the health of the population better, and that and wanting to do essentially good is very much a public health ethos, so that we're very proud of here.
That's great, Gillian. Thank you for being with us here today.